When I speak with municipal leaders, substance abuse, mental health, and supportive housing are consistently top-of-mind issues raised. I've also heard that the status quo of drug consumption sites is not working. Parents are worried about discarded needles that their children could pick up. Some parents no longer feel comfortable sending their children to the local elementary school or have pulled them out of their local daycare. Businesses and communities are concerned about disruptive behavior that increases crime around drug consumption sites that impact their communities. Just last year, for example, compared to the rest of the city, there was a 113% increase in reports of assault near these sites in Toronto. Violent crime was up 146% near Ottawa's Somerset site, and homicide was 450% higher near Hamilton's urban core. We also know that the cycle of addiction is not being broken by using drug consumption sites. We need to do more to support a journey into treatment and recovery, to keep communities safe, and to address the tragic impact of substance abuse, drug overdoses, and opioid-related deaths have in our communities. It feels like every day we turn on the news and learn more about the tragic outcome of an approach that accepts and promotes the use of illegal drugs over treatment and recovery. You don't need to tell me about British Columbia's recent decisions to end its dangerous experiment with so-called safe supply and rampant drug use. Closer to home, safer supply drugs are being diverted and sold in the black market in London. Residents near Ottawa sites are concerned about the drug-related crimes in their community. And in Toronto, there's been numerous stories of altercations, stabbings, shootings, and even a homicide in the vicinity of these sites. Our first priority must always be protecting our communities, especially when it comes to some of our most innocent and vulnerable, our children. The parents the Premier and I talked to are desperate for more to be done. That's why we will ban drug consumption sites within 200 meters of schools and childcare centers. We will be introducing new measures to enhance public safety for any remaining sites, including stronger safety and security plans, policies to discourage loitering, improved community engagement, and conflict de-escalation. At the same time, we will be introducing new measures that will prohibit any new CTS site from opening or participating in federal so-called safer supply initiatives. These measures are just part of the solution. We must also ensure that those struggling with addiction challenges receive the support they need, including access to supportive housing while maintaining public safety. Individuals deserve support, resources, and the opportunity to recover and thrive. Most of all, they deserve our compassion and our unrelenting commitment to help them in their journey to recovery. Thank you. It is why today we are announcing an investment of $378 million to establish 19 new homelessness and addiction recovery treatment hubs, or HEART hubs, across Ontario. The new HEART hubs build on our roadmap to wellness and the successful hub model by taking next steps to shift addiction care towards a model that emphasizes recovery, treatment, and community safety. Learning from early adopters, like the City of London, these hubs provide a comprehensive and coordinated approach to treatment, including primary care, integrated mental health and addictions care, social services and employment support, increased availability for shelter beds and supportive housing, and other supplies and services, including naloxone, on-site showers, and food. I want to be clear. they will not provide safe supply, supervised drug consumption, or needle exchange programs. The province will launch a call for proposals later this month to establish up to 10 heart hubs, welcoming community and municipal applications. In addition, the 9 publicly funded drug consumption sites within the 200-meter zone will be given the opportunity to transition into a heart hub and will be prioritized as part of the application process. This is part of our commitment to avoid gaps in care. As community leaders, you know what works best in your neighborhoods, meaning each hub will be unique with wraparound services tailored to regional needs. Heart hubs will add up to 375 supportive housing units, alongside addiction recovery and treatment beds, helping thousands of people transition to more stable, long-term housing. I want to thank the many municipal leaders who have engaged with us over the past several months, advocating for exactly this kind of community-oriented solution. Together, these new heart hubs and strengthened safety measures will better connect vulnerable people to comprehensive, evidence-based support while keeping our communities safe. Heart hubs are one of the many investments we've made to build a healthcare system that supports those dealing with mental health and addictions challenges. Through our Roadmap to Wellness, we are investing $3.8 billion over 10 years to fill gaps in mental health and addictions care, create new services, and expand existing programs. As part of our 2024 budget, we allocated an additional $396 million to continue improving access and expanding mental health and addiction services. Our investments are connecting people with the right care closer to home, including $124 million to create up to 500 more addiction recovery beds and new mobile mental health clinics in communities like Prince Edward County. $152 million for supportive housing to assist those facing homelessness while experiencing mental health and addictions challenges. And we're also investing $19 million to expand our network of youth wellness hubs, with 10 new hubs adding to the 22 that have opened under Premier Ford in every corner of Ontario, such as right here in Ottawa, in Peel Region, in Windsor, in Kenora, and in Sudbury. My colleague, Minister Galandra, is investing over $650 million in the Homelessness Prevention Program and $41.5 million for the Indigenous Supportive Housing Program. And we've been supporting 100 mobile crisis response teams in communities across Ontario, where mental health professionals partner with police to respond to mental health calls, and we know it's working. As always, Ontario will continue to partner with you as we implement the new homelessness and addiction recovery treatments and better support to people on their journey to recovery and wellness. Thank you. Stay well.